Hello my dear friends, in this video I'd like to show you a very simple and a safe technique by which you can learn to convert to the Direct Phaco Chop without producing too many complications along the learning process. Now the prerequisites are that you need to choose a grade 2 nuclear sclerotic cataract in order to perform your first Direct Phaco Chop. And then you need to understand that both cortical cleavage hydrodissection and a hydrodelineation procedure needs to be performed in order to delineate the endonucleus very clearly before you even begin to create the chop. Do not try this in very hard cataracts of grade 3 or grade 4 and above. Now let's move on to case number 1. In this case, I'm performing the Capsulorhexis using a 26 gauge cystotome. I start in the center, I create the C-tear, and then very carefully I fashion the CCC, making sure that it is nice, round, central, and about 5 millimeters in size. So once the CCC is completed, then comes the most crucial steps in the procedure. First is the hydrodelineation, which is performed with the bevel cannula, which is what I recommend. A very small amount of fluid. So the total amount of fluid used in this procedure will only be about 0.3 to 0.4 ml of BSS. Once this is achieved and the endonucleus is clearly seen, you have to perform the cortical cleavage hydrodissection, and you can see the fluid wave pass and the rise of the central nucleus. Having done this as a preparatory step, you are now ready to learn how to do the Direct Phaco Chop in this case. The phaco probe is then placed at an angle of about 30 degrees, or in other words, you have to angle the phaco probe so it's pointing towards the aura of the eye, and then starting from a point just above the center, bury the phaco tip. Now since you can clearly see the delineated endonucleus as a line, you create the chop starting from about 3/4 of the distance from the center to the edge of the endonucleus. So all you have to do is use a high vacuum, in this case a vacuum of 350 millimeters of mercury. The power needs to be set low depending upon the machine. In my Stellaris machine I'm using a power of 25% in the micropulse mode. You can use slightly higher powers depending on the machine you have. You don't need even a sharp chopper to do this if you're scared to use a sharp chopper in your first case. As you see, I'm creating the chop with a Sinskey hook only. Now it's very simple to create the chop for two reasons. One, the end of the nucleus is visible, so you don't have to carry the chopper beyond that point. Second is you can start the chop either right from the edge of the nucleus or from the peripheral 3/4 of the nucleus surface. And third, the thick epinucleus cushion is going to protect and prevent the chopper from sinking deep and hitting the posterior capsule. The Capsulorhexis edge is also well preserved simply because it is clearly visible against the delineated portion of the endonucleus. This is case number 2. I am performing the Capsulorhexis with a utrata forceps. Again, the same parameters has to be followed. Try to aim for a nice central 5 mm Capsulorhexis. Once the Capsulorhexis is performed, this is about 4.5 millimeter size. With very small aliquots of balanced salt solution, create the endonucleus. This is crucial to delineate the edge of the endonucleus because the chop can be performed only within this zone without having to carry the chopper to a deeper plane. You also have a cortical cleavage hydrodissection being performed. You can see the wave and the shallowing of the chamber, and now we are set to go, using the same parameters which I outlined in the previous case. The phaco probe, once it is pushed into the eye, you have to get a very good occlusion. In order to get the adequate occlusion, you first uncap the epinucleus. This is done only with vacuum. You don't have to give any power at all at this stage. The phaco probe is angulated, so the tip is now facing roughly towards the ora serrata of the eye, or an angulation of about 30 to 40 degrees. Once you bury the phaco tip, the nucleus will rise and you have to take either the sharp chopper or you can even use a Sinskey hook right to the edge of the nucleus and crack it. There is no need to perform a trench, there is no need to stop and chop type of procedure. You can directly go on to the chop, and it's quite simple to do in most of these cases of grade 1 to grade 2 nuclear sclerotic cataract. Learn how to do the direct chop in these type of cases using this technique. And as you get more and more confidence, you can switch and move on to harder grades of cataract where the principles of chop are more or less the same. However, the power variation and the vacuum settings and the depth of burying the phaco probe alone will vary. At the end of the procedure, the thick epinuclear shell is also easy to remove, as I have already said, because you've done a good cortical cleavage hydrodissection. The epinucleus rotates freely and it's aspirated. Try to switch to direct phaco chop using this technique and gain your confidence before trying out other techniques. All the best, and thank you for your attention.